webinars have focused on community-level workers. And in this webinar today, we'll take a look at the role of government workers, particularly those who work at the district or subnational levels, and who play a key role in supporting those community workers and systems to enhance the delivery of quality services and support to vulnerable children and families. Speakers will discuss how the social service system as a whole can be strengthened by reinforcing the technical and leadership skills of local government staff to coordinate, lead, monitor, and evaluate services and support in their region. Today we'll hear about experiences from the Bantwana initiative in Zimbabwe and the SUNRISE-OVC project in Uganda. The speakers will discuss inputs that have led to increased coordination with community structures, better workforce planning and skills development, strengthened referral systems and case management systems, stronger monitoring and evaluation systems, improved annual planning and budgeting for social services, and ultimately stronger services for children and families. We will leave time for all of you to ask questions and to discuss similar work occurring in your countries. Let me go ahead and introduce today's speakers. Today's session will begin by a presentation by Grace Mayanja, who is the International HIV/AIDS Alliance's Chief of Party for the SUNRISE-OVC project in Uganda. Her many years of leadership experience prior to this role have included being Chief of Party for the USAID CORE project in Uganda to support and build capacity of the Uganda Ministry of Gender, Labor, and Social Development to lead and coordinate the national OVC response. Her other experience includes working with World Vision as technical advisor for the Orphans and Vulnerable Children in HIV/AIDS Models of Learning Global HOPE Initiative program. She holds a Master of Science degree in International Development Studies at the University College in Dublin, Ireland. She also studied Gender and Development Studies and also holds a postgraduate diploma in management. As Grace is presenting, if any questions come to mind, please feel free to type them into the chat window. We will track the questions coming in, and then Jim McCaffrey from Capacity Plus will be moderating a question and answer period after Grace's presentation. We will then move on to our second presenter today, Patience Ndlovu, who is the country director for World Education Bantwana initiative in Zimbabwe. She has over 17 years experience in development and emergency relief. Before joining Bantwana, Patience managed the OVC program for the Capernaum Trust in Zimbabwe, and under World Vision International Zimbabwe, Patience provided technical support to the National Director in strategic planning, policy development, negotiations, proposal writing, reporting, implementation, monitoring, and evaluation of all country programs. She was also instrumental in the design of the USAID WSP-funded food aid program. She has a master's in policy studies. And again, after she presents, Jim McCaffrey will moderate any questions that you have for Patience. We'll then have a discussion session where we'll invite you to discuss your programs and ask questions of one another or to either of the speakers. And then I'll wrap up the session and invite you to type in any announcements that you may have. So at this point, I will hand over the microphone to Grace. And again, just a reminder to type in any questions. And Grace, please go ahead.
All right. Thank you very much, Annie. And thank you very much for this opportunity for the presentation. And also, Annie, should I be seeing the presentation on the screen?
You should be, yes. Stephanie, if you're able to provide any assistance to help her see it. If not, I can help you click through the slides.
Yeah, because I'm not seeing the presentation, but I can go through the slides because I have them, if that's okay.
All right, sounds good. Sorry about that little glitch.
Okay, so let me start with the slides that I have, and maybe they will come and find me along the way. Thank you, Amy, for the kind presentation, and I'll start straight to the presentation. And I'm going to share with everyone the Ugandan experience working through the USAID Uganda SUNRISE-OVC project in strengthening Government of Uganda district social service workforce to coordinate and oversee social services. As if you are able to look at the slide, there is a slide that is providing the Government of Uganda social service workforce structure. Just to give us a context of Uganda and how the social service workforce is organized. The role for overseeing programs for protection of children and other vulnerable groups is with the Ministry of Gender, Labour and Social Development that provides leadership and technical oversight, quality assurance, and policy development. And then below the Ministry of Gender, Labour and Social Development, Uganda is working in a decentralized system framework. Then there are districts, and in Uganda there are 112 districts. And within the districts there is a department for community development. And within that department, there are district community development officers and then district probation and social welfare officers. And those are responsible for providing program management and oversight at the district. And in Uganda, a district has a population of about 300,000 people. So there is one probation officer and one district community development officer for the population of about 300,000 people. Within the district, there are sub-counties, and the district would normally have an average of about 10 sub-counties. And in each one of the sub-counties, there are community development officers. And these are responsible for community mobilization and family empowerment. They conduct community outreach and routine home visits to vulnerable families. They are generally responsible for ensuring quality and equitable access to services for vulnerable groups and all other people in the sub-county. And the sub-county would have a population of about 25,000 people. And below the sub-county are community structures. And these community structures are both formal, and the formal structures are mainly elected village councils. And then there are many informal community groups that include village health teams, child protection committees, people living with HIV/AIDS groups, community-based organizations, FBO, faith-based organizations, among others. And then across this structure there are civil society organizations, NGOs and faith-based organizations, as well as the private sector that work, across this structure. And some are national, some are local organizations. And then within the community, of course, we have families and children. So the SUNRISE-OVC program works in 80 of the Ugandan districts, and that represents 72% of the national coverage of the district. So it is from that context that I'll be sharing our experience working and supporting Ugandan district social service workforce. In Uganda, the project SUNRISE started in 2010. And when we started, we carried out a needs assessment, and together we looked at the available data with the ministry and the Uganda Bureau of the the Uganda Bureau of Statistics that carries out national surveys, and we realized that there were the following key needs for the social workforce. One was the prioritization of the community development officer positions in the recruitment round is often neglected. And as you can see from the slide, the statistics, you can see that 44% of the districts assessed had no substantive probation and social welfare officer positions filled, and the average social worker child ratio was 1 to 6,000, one social worker 6,000 children, compared to the standard ratio of 1,200. There were inadequate skills with the staff, and we found out that 72% of the community-based services department staff lacked adequate skills in social work. The staff lacked adequate facilitation and supervision to be able to deliver their child protection and social care roles adequately, and mainly the sub-county or the frontline social workers. And as you can see that 80% of the staff indicated that they lacked adequate transport for them to be able to conduct the home visits and carry out social inquiries and community mobilization activities. 72% of them cited lack of fuel and irregular funding for program work was cited by 64% of the respondents. Inadequate infrastructure was another major challenge or problem affecting the social welfare workforce. So the SUNRISE program intervened, and because the purpose of the SUNRISE program is to strengthen systems for expanded delivery of services for orphans and other vulnerable children. So we needed to tackle systems that will ensure concrete results for vulnerable children. And one of the key strategies that we have used and has delivered significant results in the district for OVC is the Leadership Development Program. The aim of the Leadership Development Program is to develop leadership and management skills for child protection at district and for civil society organizations. And we have so far supported 382 district leaders and civil society organization managers in 64 districts to undertake the Leadership Development Program. The program has built the leadership capacity of social development managers to learn leadership and management practices, to face challenges and achieve measurable results. The Leadership Development Program uses a challenge model for a district team, and in our case, the challenge for the district team is around how to improve child protection and social care for vulnerable children. And so through the Leadership Development Program, the district workplace teams together build their leadership and management capacity. They apply new skills to real challenges and achieve results at the end of the period of 4 to 6 months period. So it's a practice-oriented leadership development program that focuses the district team on how best can they turn around the challenges affecting vulnerable children in the district. And so that has been and continues to be one of our key strategies in delivering and strengthening the leadership of the district to be able to effectively manage the response to child protection and social care. The other strategy that we have used and has been quite successful in delivering results for vulnerable children is the in-service training program. And the aim of the in-service training program is to develop the capacity required to deliver quality services by local government and other government agencies staff working with vulnerable children in the district. This program is a practice-oriented certificate course in child protection. It's a 1-month classroom and field-based training on child protection that was, in our case for Sunrise, was delivered by Makerere University Social Science Faculty, the Department of Social Work and Social Development. Participants were assessed before the training to assess their knowledge levels, and they were assessed, of course, during the training and after the training. They were scored and graded, and the finalists that qualified received the university's accredited certificate. The course consists of the following 5 major modules, broken down into sub-modules. As you can see, the introduction to child protection, legal framework and policy guidelines in child protection, formal and informal child protection systems, prevention and response strategies for child rights violations, and monitoring and evaluation of child protection interventions. And so far for Sunrise, we've supported 1,345 community development officers and selected probation officers and other social service workers who represent 1,056 sub-counties, and these constitute 96% of the sub-counties in the 80 districts that completed and attained this Makerere University Child Protection accredited certificate. This in-service training has paid very good dividends out following the completion of the training, as most of the frontline social workers were not familiar with child protection work. It was delivered by a credible institution, Makerere University, and it generated a lot of enthusiasm from the frontline workers that are now vigilant in planning and implementing programs for child protection at sub-county and community levels. The other major strategy that we are using is the district, what's called the district orphans and other vulnerable children coordination committees. These committees are provided for in the national policy and strategy for vulnerable children, so they are provided for by the government, by the policy. And the aim of that structure is to support district level social service workforce structures of local government for child protection and social care. The aim is to ensure a multi-sectoral coordination across sectors of the district, since support for child protection is a cross-cutting issue. So Sunrise supported the composition and activities of these multi-sectoral coordination committees. In some districts, these committees already existed and just needed budget support. They needed tools and support coaching, which the project initially provided. The project works very closely with the central ministry, so our role is to take down the national strategies, policies, guidelines, and standards. And so Sunrise supported this structure by orienting them and mentoring them and providing support coaching on implementation of the national policies and strategies. These structures exist in almost all the 80 districts, and they are currently active in developing service delivery plans. They develop 76 of the 80 districts have developed strategic plans for orphans and other vulnerable children that have been now integrated in the district development plan. So it is this structure that has spearheaded the development and approval of those district strategic plans for orphans and other vulnerable children. They provide support supervision to district partners. They receive and analyze and discuss district-specific data on service provision to vulnerable children and make decisions on coverage, on quality, and other policy issues. Most of the districts have developed ordinances or bylaws to improve protection of children, like ordinances of children in school or related to child labor as a result of discussing this data. They advocate for staffing improvements. They look at the staffing status on a quarterly basis and make decisions. And they champion budgeting and allocation of resources for orphans and other vulnerable children. The representation on these committees is of managers from all key district sectors of health, education, planning, police, production, and community services. There is a representation of civil society organizations and private sector agencies on this committee. And so this structure directly supports the roles of the district community development officer and the probation officer. So it has been an instrumental structure to work with in the district to spearhead the responses to child protection and social care issues for children. A related structure is one at the sub-county level. It's called the Sub-County Orphans and Other Vulnerable Children Committee. It is a replica of the district level structure, so the two work hand in hand. And in the same way, SUNRISE has supported this sub-county level structure that is also now vigilant in leading and managing and coordinating the responses to vulnerable children at the sub-counties. And SUNRISE works in 1,089 sub-counties in the 80 districts. And so we work through the districts to be able to support the functionality of those sub-county level structures. And the sub-county committee horizontally assists the community development officer in planning for vulnerable children, in monitoring and providing support supervision to sub-county level service providers, in coordinating the actors, and in championing the budget allocations at the sub-district level. Then, in addition, another major strategy that SUNRISE has used in strengthening the government social service workforce has been the community parasocial workers. The aim of the community parasocial workers is to support the community responses for orphans and other vulnerable children. As I did mention at the start, there is one community development officer in a sub-county, and the sub-county has about an estimated 5,500 vulnerable children. And so there is a gap between the sub-county government officer and many households of vulnerable children that require support. So it was necessary that we strengthen a structure that is closer to the household and can link them with the community development officers and other facilities for referrals. So these are communities informal social service workforce groups. There are very many groups operating at the community level, and in some communities there are village health teams or local council courts or child protection committees, or there are local religious leaders or people living with HIV/AIDS groups, functional adult literacy groups, women's associations and youth associations, clan leaders, and many other kinds of groups that are working to support children, but do not have adequate skills and capacity to identify, to assess, to be able to refer children in need of protection. So we strengthen this layer in the structure to help ease on the overwhelming workload of the community development officers and also bridge the household to a government social service workforce system. And so far, over 4,000 community para-social workers have received a practice-oriented training using a curriculum that was jointly developed by UNICEF and government for community child protection workers. It's a tested curriculum, and these were trained for a month. These community structures are trained for a period of about a month and can later identify vulnerable children, work to respond, to identify cases of abuse, to build resilience of families, to protect children, and to refer those that are identified to specialist services and to CD community development officers for management of more complex cases that they cannot manage. And this structure has been quite instrumental in increasing access to services for vulnerable children from our experience. So some of the key outcomes that we have realized so far relate to district social service workforce improvement, and so far 51, comprising of 63% of the project target 80 districts have attained hiring of at least 60% of their key staff positions of district community development officers, probation officers, and district community development officers. As we noted from the beginning, this has been an improvement from the situation that it was in 2010. And we realized that out of the estimated over 2,000 community development officers and their assistant positions at sub-county level in the 80 districts, 1,300 are currently filled, representing 61%, which is an increase from 41% that it was in 2010. And we think there has been a tremendous improvement that we keep celebrating. As I did mention that the coordination mechanisms are functioning in 90% of the districts and 73% of the sub-counties in the project coverage, and 96% of the districts have approved district strategic plans for vulnerable children that have been approved by district councils. These are policy-making bodies in the local government, and the activities for vulnerable children have been integrated in the district development plan for broader support of the district. Another outcome relates to resource allocation. Due to the monitoring and advocacy efforts by the currently more competent social service workforce, average allocation of locally raised revenue and unconditional grants to the community services sector that spearheads support for children has increased by 6 percentage points since the start of the project in 2010. When we started, the average percentage allocation was less than 1% in the district, and as we speak, the average allocation for community-based services department in the district is 6.7%. So we're happy that we have made that progress, and we're working towards making sure that it's sustained. The other outcomes relate to improved information management, and 79 districts are continuously reporting, analyzing, and discussing data related to vulnerable children, and over 1,000 service providers are currently participating and reporting through the district on their programs. Service Service provider coordination has also improved, with 2,700 civil society organizations participating in these coordination activities, and districts have improved in their provision of support supervision to ensure quality of services for these service providers. And so the key impacts that we have realized over time are: one, that 296,358 vulnerable children and over 870,000 vulnerable children have received child protection and support. And the 296,000 have received direct support through the community development officers and probation officers, while the over 870 have indirectly received the support through the strengthened systems. And these have received a range of child protection and care services, as well as interventions aimed at preventing child abuse and improving protection of the children. And these have been possible within a government system that SUNRISE has supported. In Uganda, USAID supports the Lot Quality Assurance Sampling Survey, and this data is collected across all the different areas of HIV/AIDS, health, education, and orphans and other vulnerable children is one of the areas where the survey data is collected. And from 35 districts, the data available indicates that between 2011 and 2013, 83% of the districts have had a decrease in the percentage of orphans and other vulnerable children aged 5 to 17 years that are experiencing cases of child abuse. So to us, this is an indication that we are moving in the right direction, and the strategies are beginning to yield some results. Of course, this is not purely attributed to SUNRISE, but we believe that SUNRISE has made a significant contribution towards realizing this progress. So therefore, from our SUNRISE experience, our conclusions are that adequate staffing and institutionalized funding mechanism under government control can deliver protection and welfare services to vulnerable families and children across the country in a timely, reliable, predictable, and sustainable manner. If we have a strong government system, then we are able to reach out to the entire country and in a sustainable manner. And also, we note that while child protection and care services include a wide range of services that are provided by both the informal structures and formal actors, government workers play a critical role in creating a safe environment that the children require, in providing specialist care and support at facilities and different points, and in strengthening community and family as the first line of response. So we believe that the government social service workforce is very critical for supporting the community and other levels of response to child protection issues. So I want to thank you very much and thank the SUNRISE-OVC project for the impact registered on the objective of strengthening the social service workforce and on its other objectives. We are thankful to USAID for providing the funding, to the government of Uganda's Ministry of Gender, Labour and Social Development for the leadership and government-level technical oversight that we've enjoyed, for international HIV and AIDS that is working with its partners in managing the SUNRISE-OVC program, and its partners, including Ugandan women efforts to save orphans and management sciences for health, and the 8 project zonal level technical service organizations that we work with to support the 80 districts, and also the 80 districts of the project coverage across all regions of the country that is such a large coverage of 72% of the country. Thank you very much for listening to me. So I hand over back to you.
Jim, thank you very much, Grace. That was a very good description of this program that had as a goal to strengthen the social service workforce, the ability to coordinate and oversee social services at the district level. So there was much good material in there. It was a very comprehensive description. So we're going to ask people who are participating to write any questions they have in the chat window, and we'll pose those to Grace, and we'll take 10 or 15 minutes now, and then move on to the next presentation, and do the same thing, and then we'll have some time at the end to ask general questions of either one. So I'm going to start with a question from Lisa, and it says, is there an issue of staff turnover within local governments, and how do you ensure sustainability for the trainings conducted? In some ways, this is 2 questions. One is around staff turnover within local government, and then how do you ensure sustainability for trainings conducted? So Grace, I will hand it back to you, and maybe you could say a few words about that question.
Thank you very much for that question, Yusuf. Staff turnover in the district is such a major problem that we continue to face. When these staff were trained, it was exciting and very good for the district. They were very happy. It was delivered by credible institutions, and this staff had a certificate on them, and so they were, happy to take over other responsibilities. So a number of them have been promoted and have taken over the roles of sub-county chief, the head of the sub-county, and we realized that continued to create a gap in the positions of community development officers. So what we've done, we continue to work with the district to make sure that as soon as that position, the person takes over another position, that there are immediate measures to replace and to fill that vacant position. And so because that position already has funds within the district, and so the proceeding, replacing that person would not be a problem. So that is done. And the districts have assured us, in some cases the districts have contained and maintained the staff, but in some districts they have assured us that since the staff are remaining within the district, they will continue to spearhead the support to vulnerable children. And so I think what the ministry is doing is we are now discussing with the National Child Protection Working Group to continue refreshing and training those staff that come on board and are not trained. So the sustainability of the training conducted, I think, is mainly through ensuring that we continue to train the new staff that come on board. And a good thing is that the staff are not moving out of the districts but remaining within the districts. But certainly the staff turnover is a problem. And I need to mention that staff turnover is not a problem only with the government, even with the civil society organizations. We've done quality improvement capacity building with civil society organizations, but we also realize that there is a very high staff turnover within civil society organizations. So that certainly continues to be a challenge.
Okay, Grace, thank you very much. We had a couple other questions in the same area, so I will go ahead and ask them. One from Rebecca first, and then Patience. Since we're talking about these staff, Rebecca asked, are the staff hired by the districts as part of the government establishment, or are they hired as contractual staff?
Oh, the staff are permanent government staff. They are hired by the government, by the government establishment, yes.
Okay. And then Patience asked, did you have COSs with staff at the sub-district level, and if so, what's their relationship with the local government staff?
What does that mean? Do you have...
Yeah, actually, let me ask Patience to clarify what you meant by CSOSs. NGO staff, sorry, that was a typo. So do you have NGO with staff at the sub-district level? And if so, what's their relationship with the local government staff? Okay, that clarifies it.
Okay. Okay. Yeah, there are, on average, there are about 50 civil society organizations in a district, both the district level and smaller community-based organizations that have staff. So as I did mention, one of the, maybe I didn't mention it, but we do support the coordination mechanisms with civil society organizations and local governments. So they meet regularly and they share what they do, and for some of the districts, they've signed what they call standard operating procedures in supporting vulnerable children to ensure that civil society organizations regularly report what they are doing. They are open to referrals when need comes, and they adhere to the quality standards of services, and also they support and raise resources for increasing coverage of services. So they are regularly meeting with the local governments, and also the local governments are regularly supervising and visiting the civil society organizations to ensure that the services they are providing adhere to government quality standards. And by statute, all civil society organizations that operate in the district do register with the Community Services Department. So all these organizations are registered. We realize that there are some children institutions, or those we normally call orphanages, that are not registered, and we've worked with the district to ensure that every single organization operating in the district is fully registered and recognized in the district.
Okay, great. So definitely NGOs included in the various coordination mechanisms, and in terms of being registered, that's happening also. As long as we're talking about coordination, I had a question about it. You have coordination mechanisms both at the district level and at the sub-county level. And our experience has been, just looking at it globally, that coordination looks easy on the surface, but is often quite difficult to do and to sustain. And so I was wondering what might be some specific kind of best practices or actions that were taken to make the coordination really work well.
One of the experiences of best practices we have realized is the district leadership. When we started, we had anticipated that civil society were going to have to coordinate themselves and as civil society to have their spaces and do their work and then get the district involved. But we realized that that was not working well. And in districts that had leadership, where the district spearheaded that coordination, they invited the civil society organizations and they guided them on what presentations to make, and they visited them. That was working very well. So the district leadership in coordinating those actors is very important from our experience. And also the data, use of data. The districts realize that they have a big problem of vulnerable children, and they realize that alone they may not realize results. They may not have a lot to report and to demonstrate that they are progressing unless they work together with the NGOs and civil society organizations in the district. So that created an interest in the districts to make sure they bring all the other actors on board, and so together they can be working towards, improving service delivery. So yes, the district leadership and use of sound data by the district and for the civil society organizations to realize, to keep monitoring how they are progressing in the district. Of course, we have, with 2,700 civil society organizations participating, that's 50% of the expected civil society organizations. So we haven't gotten all of them on board, but we hope that that is creating some basis or some benchmark that the other organizations can emulate and start coming on board. In fact, recently we've had most of the district chief administrative officers making it mandatory that these civil society organizations have to come and coordinate regularly with the district.
Okay, great. Let's take one more question at this point, and then we can return to some of these later. They may also pertain to Zimbabwe. Oops. So this one was from Diane Falk, who said, and I'll kind of read this, I just returned from Uganda where during a 3-week stay, I had the opportunity to attend a training for social service workers and police officers at the district level on the child helpline that is being initiated. The trainers urged the small number of participants to assist the Ministry of Gender, Labor, and Social Development in following up on calls to the central call line. Yet the workers have their hands full with other responsibilities. It was clear that the workforce is not really adequate to handle all of these responsibilities. So the question was, what's being done to increase the social service workforce at the community level?
Yeah, certainly we know, as I did mention, that the ratio of the government social workers to vulnerable children is way above. It's currently one to 1 CBO to like 5,000 vulnerable children. And so the strengthening of the community parasocial workers for us is one of the major strategies. And we were here doing the calculations and the estimations, and we realized that currently one community parasocial workers is seeing about 50 children per month. And so we realized that if we have parasocial workers, adequate parasocial workers, we would be able to cover very many vulnerable children. That for every parasocial worker, like we would have about, if we have about a certain number of about 50 children per parasocial worker, then we are sure that we have a mechanism that is overseeing closely the issues affecting children, and this can easily be, the children can easily be assessed and supported or referred to services. So it's strengthening the community informal structures is one mechanism that we are strengthening. The other one, we are working with the central ministry, and they are currently the government of Uganda is developing the social protection policy framework, and we are working with them and suggesting that we have an additional position at the sub-county level to handle specifically probation work. And within the rolling out of the National Child Helpline, of course, we are bringing civil society on board to support the districts to act as call centers or action centers, so that when a call comes in, there is a civil society organization that can respond and refer the child and follow up the case as required. But the community level structures and mechanisms are helping us to identify and refer the children and follow up, and making sure that they follow up, they conduct home visits to confirm that where the children were referred, they indeed received the service.
Okay, so basically working at two levels, one with the community informal structures, and the other is working at the with the central ministries to develop a social development policy, which eventually would impact services at the community level. Okay, thank you very much for addressing the questions. And if anybody has any further questions, you can type them in the box at any point. We'll be able to have 10 minutes or so as we near the end of the session to ask questions of either Grace or Patience. But we wanted to go ahead and move forward to Patience, who is going to talk about the strategy and the work that they're doing in Zimbabwe. So Patience, I'll go ahead and turn it over to you.
Thank you very much. Thank you very much, Alex and Emmy. I will take you through our experiences. Can you hear me?
Yes, you are coming through fine.
Okay, great. So I am going to give an overview on the work that we have been doing, working with the Ministry of Labor and social welfare in our country to strengthen workforce at the district level through the support that we have received through the USAID-funded Bantwana project, as well as the predecessor project to Bantwana called Children First. We started this work with USAID since 2009, and we've been working very closely with the government. With that work we started under Children First. We piloted a model in one of the districts in the country, which was a case management program that then has received additional funding to scale it up to almost the entire country with funding from UNICEF. UNICEF is covering almost 37 districts of the country, while USAID is covering about 21 districts, just working very closely at the district and community level, working with care workers who are community volunteers, which is the first direct response for children and for the care of children at the village level, and they are linked into the district level. So I wanted to give in that background before I even get into some of the contextual background, so that when I start speaking to some of the strategies that we have adopted, you are clear where we are coming from. So over and above the case management program, we have been implementing a very streamlined and targeted workforce strengthening strategy through the USAID Bantwana project, touching various areas, working with universities, working with schools of social work, working with Council of Social Work, National Association of Social Workers in country, to beef up support for government district workers at that level. So I just wanted to give you just that brief overview of the two projects so that you can understand how the work is panned out over the years. It is important for me at this stage to give you a background of our country's situation. I think it's critical for us to mention the year 2008 because I think, as most of you might be aware, we had a very challenging socio-economic political environment in our country, and that had a serious impact on the capacity of government to respond and to the issues of children and to support child protection and child welfare in country. So I think most of you are aware that we had an economic meltdown where we had very high inflation levels in the country which could not support the functioning of a proper economy. We had a breakdown of public systems at some point where our schools were not working very well, our clinics were closed, we didn't have enough drugs and so forth. Skills flight is particularly critical when it comes to the Ministry of Labor and Social Welfare, because most of the social workers that were graduating from the School of Social Work were migrating to other countries for greener pastures, and therefore that left the system very, very weakened. We had an emergency situation declared by UNICEF as a result of all of these sectors working together, and some donor transition funds were set up to support government, some of which I spoke about. The case management program that we are implementing with funding from UNICEF is part of those transition funds that were set up. What the crisis meant for children is that, 25% of the children in Zimbabwe became orphaned and very vulnerable, with about 3 million children living below the poverty line. And, for the government to respond to that kind of situation, we had a challenging environment. Like I said, we had a high skills flight, and in government we were looking at, a ratio of 1 social worker to 44,000. I heard Grace talk about figures of around more than 5,000 and so on. For us at that point, we were looking at 1 social worker to 44,000 children, which is extremely high. There was a challenge of inadequate professional qualifications for the few social workers who had remained in post in government. We had inexperienced staff in post because now most of the experienced social workers had left the country, and we were having new graduates coming from the School of Social Work taking up posts within the system. Also, weak coordination mechanisms at the district level, and most of the inexperienced staff that I spoke about, and also the weak coordination. Some of them, yes, they were graduate social workers, but most of them were non-social workers that were coming to join the department. In light of this contextual challenge, Worlded Bantwana worked very closely with the Ministry of Labor and Social Welfare, particularly the department that deals with child welfare and probation services, with funding from USAID and UNICEF, to develop a multi-pronged approach to respond to this challenge. So, how did I, sorry. Okay. Okay. Sorry, I'm just trying to work the controls here. I think there is something missing on the multi-pronged strengthening strategy, but I had a diagram there. It's not coming out well on the screen. The diagram is showing that we came up with several strategies to respond to the challenge that was on hand. We had post-qualifying training that was developed for a number of the staffing, and I think I'll just walk them as the slides come through. We developed a post-qualifying training for some of the non-social workers within the department, because what was now happening was the department was getting staff that had social science degrees and not really social welfare trained officers. And so we developed, worked very closely with one of the local universities, Women's University, to develop a postgraduate diploma for the staff that were in post, so that they could be supported and their skills would be upgraded to understand more social work practice rather than just general development work. In addition, we also developed a certificate program working with the Women's University as well to offer that support. For the diploma and the certificate programs, the emphasis was on helping these officers understand probation work, child welfare, child rights programming, case work, social policy, economic development, and community work. That was the focus. And as a result, we were able to train about 80 district staff in our country, which is almost the same setup as what Grace described in terms of how the system works at national, provincial, sub-national level, which is the district level, and then down to the village level. We had these 80 district staff trained and supported to specialize in the postgraduate and in the certificate postgraduate training programs. And of that, we were able, I think, in just for you to understand the impact of the work, we were able to cover 40% of the staff within the department to do that. We have about 65 districts in country, and the ideal at any stage is that we should have at least 3 social workers at each of those 65 districts. Now, what happened when we had the skills flight is we were left with, like one social social worker in each of those districts, and that was a very challenging state of affairs. Just one person having to deal with all the cases for child protection, as well as welfare cases that were coming in at that time. Also, in practice training of probation officers, what we have done in country to upgrade the skills of the district social services officers is to identify a national core team of trainers that is trained, particularly one in the case management system that we have recently developed with the Ministry of Labor and Social Services that I alluded to, which we are rolling out with UNICEF and USAID. So a national core team of trainers has been identified who are empowered with skills to roll out training to all the districts in the country in training on case management. They are also responsible for training our child protection committees at district level, and as well as other key trainings that come up for the department. Task shifting, a very critical issue for us, especially in relation to the training of parasocial workers. At community level, we have the community volunteers, who we are calling the case care workers, through the case management system. And so because of the challenge that we were facing with a lot of social workers having to take up frontline or cases, we had to get a mechanism where you have community volunteers being able to pick up some of those general welfare issues for children. So, as a result, it's exciting for us, because since we started training case care workers at community level, we initially started with 11 districts. We are currently rolling out that program nationally, and what we have observed just from the caseload that most of the data that is coming through from the districts, at least 75% of the cases that we were getting under the system are child welfare cases, and then 25% are the real child protection cases that would need probation support and a qualified social worker to deal with. So these frontline parasocial workers in the form of the case care workers have been able to take those tasks away from the qualified social workers, and have been able and are now able to deal with those cases, thus, alleviating the burden of the caseloads that our limited number of social workers were having to deal with on a day-to-day basis. Another of the strategies that we took on board were on-the-job trainings or in-service training for the district social workers that we are working with. Like I said before, most of them were not qualified social workers, so we had to invest a lot in training them to understand child protection issues, to understand child safeguarding issues, to understand that they are the custodians on behalf of the government of child protection at district level and community level, and also how they then support the community volunteers to be able to enforce child protection at the village level as they work with, with leadership at that level and so on. So we actually had a training of most of the workers that we are working with under the system through a 1-week training, going through all of these issues, helping them to even design risk mitigation strategies, and everybody coming up with a risk mitigation plan for their district in terms of child protection and child safeguarding. Secondly, development of post-qualifying training frameworks for probation work. We had a probation work manual developed by the government, which I think had been outdated for a number of years. We've worked very closely with UNICEF to update this probation manual to also include emerging issues around child protection, but specifically the case management frameworks that have been recently developed. In addition, most of these district social workers have received training for them to be able to facilitate stakeholder case management processes and meetings. So they are supposed to take the lead. They are now taking the leadership at district level to facilitate the setup of case management in a district, to facilitate development of referral networks, engagement with stakeholders, linkages with other government sector ministries in terms of the processes, referrals, as well as coordinating case conferences and meetings at district level. In addition, working with and supporting community volunteers, the district social service officers have now been empowered through this training to work very directly with community volunteers, where there is a clear linkage, communication, and feedback and day-to-day support that they provide to the case care workers as the case care workers interact with children and with families at the village level. So they are quite confident now, I think, to know what cases to deal with and how they provide the support that the volunteers require at village level. Mapping of service providers and design of referral systems. This is all part of the case management system, so they take the leading role, working with civil society organizations or NGOs at the local level, mapping who is providing what services, working with other government sector ministries, who is providing what services. So if you get to a district level, you will see that most of those districts actually have a service map that shows who's providing what services and who are the contacts and how do they access the services for the children if need be. design of referral systems very critical, because like I said earlier, we had weak coordination mechanisms. So through the case management system, they've been able to design referral systems. If a child is, has been abused, where do they go? Who are they referred to? And because they are in direct contact with some of those service providers, they are then able to refer the cases in a timely manner and as well as effectively. M&E and progress tracking. Through the case management system, again, we developed, working closely with the ministry, some M&E and data collection tools, first for the volunteers at community level, but also at the district level. And some kind of databases have been established to be able to for us to identify, the categories, the types of cases that are coming through, and even a triaging, mechanism on what kind of cases are going where. The system has not been efficient, so what we are now working on right now is to develop a very robust MIS system that brings all the components for social services at district level together. We are implementing cash transfers in some of the districts where we are operating, so we are harmonizing that system with this case management system at district level. The idea is that it should be easy at district level for the head of that district to track what cases are outstanding, what cases have not been closed, what cases need urgent attention, which ones should be sent up, and so on and so forth. The same for the province. They should be able to identify through that system how well each district is working, how well they are collecting the data, how well they are responding to the cases, and why some cases are not being responded to in a timely manner. That way, we are then able to enhance the performance that is taking place at each of those various levels, at community as well as district level, but with that provincial oversight from the province itself. In addition to on-the-job training, we have support supervision and mentorship. We developed a support supervision strategy under the case management program that we have been working on, where district supervisors are trained to supervise and to mentor their own staff at that level. So a lot of support has been given, but the gap that we were noticing was that, while they came for training, and as you conduct your monitoring visits, you then identify that there is need in some cases to then enhance that support supervision through practical support. So we have introduced a clinical supervision component where, the person who supervises actually sits in, identifies, works with the person who is doing the supervision, identifies where the strong areas are, where the weak areas are, and then provides support supervision after that. So that it's a system that cascades from the provincial level, the district, and then down to the village level. Supporting lateral skills transfer through exchange visits. We have noticed over the time that we have been implementing the program that there are some districts which do better than others, and the idea was how do we make it more useful for district staff to learn from each other in a very practical way. So we facilitate exchange visits from those who are doing very well to those who are not doing very well. But also the lateral skills transfer is, just a twinning or budding mechanism, where if we have strong social workers in one district, they are supported in a budding manner with another district. Or if you have social workers within NGO partners who are very strong, they also support the workers who are at the district level. So a twinning and budding mechanism is what we have come up with, and this has been facilitated through the case management program. In most cases, what has happened with case management is that we have been able and lucky enough to recruit qualified social workers who are acting as case management officers. So they provide mentorship to the districts, to some of the district social welfare staff at that level. Then results-based performance management, very critical. Our government has a results-based performance management system that they have been rolling out. And what we are trying to do is to link the MIS system that I have spoken about to the results-based performance management system of the government, so that they are speaking to each other, so that whatever you are getting from the support supervision, it feeds into the results-based performance management in terms of either there are recommendations that are coming from the process, or if it is information coming out of the MIS system, how is that information feeding into the results-based performance management, so that there is enhanced performance at the district level, and the managers are accountable for what is happening at that level. I should also highlight that under the case management program, the officers that we have been working with are contract officers. They are contract staff. They are actually on contract, and therefore their role is to provide that support to the full-time staff that are at district level, because they are better qualified, they have better qualification, better experience, and so on and so forth. And all of that is feeding into the results-based performance management system. This is my last slide, talking about the impact of workforce strengthening on the general OVC landscape in our country, on the general social protection environment in the country, but also at community level, creating safe environments and safe spaces for children, but also working very strongly on the preventative aspect for against, in terms of mitigating child abuse. And the first thing I must mention is that we are at a very interesting time in our country, in that under the Ministry of Labor and Social Services, we had a Department of Social Services which was carrying both welfare issues, whether they are for adults or for children. Everything was in one department. But what we now have is the formation of a standalone department specifically looking at child welfare and probation services. And we feel that the work that has been going on, working with the government, has resulted in the formation of this department. Why? Because now we have a clear case management system that has been set up in the department, but also we have had an investment case created for the recruitment of more social workers in our government. As it stands right now, from the time that we started this program, the case management program in 2009, where we only had one social worker in some districts, I think there were about 25 districts that didn't even have a social worker. We are happy, and glad to inform you that now we have, at least 2 social workers for each district, and also we actually have with that standalone department, social workers specifically looking at child welfare and probation services. So an investment case has been made for the recruitment of social workers because of the challenges too that we're having with the economy. There was a freeze on the recruitment of social workers by our government, but I think clearly with the kind of impact, with the outcomes and the results that we are experiencing, we have now had a recruitment of more social workers. So as we scale up or roll out the case management program across the districts in the country, we know that the program is going to be well supported, because on one hand you now have enough social workers to support the system, as well as community level cadres who can support the system and link into the districts. clearly there's improved skills for social workers at the district level. I think with more of these in-service trainings that we have had, we can see the changes that are taking place. You can see that because more and more the social workers are very confident in leading the rollout of the case management system, in triaging cases, in supporting volunteers at the district level. In addition, we have very better strengthened coordination mechanisms. I can't say very strong, but I think we are seeing an improvement in the coordination mechanisms, because all the stakeholders that are involved at the district who have to be part of this case management system, get to know what their different roles and responsibilities are and what their parameters are, and therefore, there is easy referral of cases from one sector ministry to another, as we support the cases that are coming from the case care workers. Lastly, I think the biggest impact that we are seeing on the OVC landscape in the country that has really changed the way we are doing things is this new case management system that has now been put in place, that is clearly linking community informal care structures with the formal district structures, working very closely and in collaboration to ensure that, to ensure a continuum of care really for children, and to ensure that every child who needs assistance is walked through the systems until they are able to receive the support that they need. As it stands now, yes, because of the of an economy that is not performing so well, we still have challenges in terms of service provision in some cases. But what we are happy about is that there is a clear system set in place which is ensuring that there is better coordination, there is better, referrals. The way we are effecting referrals is much more clearer. There are stronger protective environments set at the community level because of the involvement of our district child protection committees, who are led by these social workers at the district level and so forth. So, on the whole, the workforce strengthening impact is really recognized at the community level, at the family level, and on the general child well-being at the child level. So, in a nutshell, that is the work that we have been doing in country, and just to say thank you to our Department of Social Services, or the department that is dealing with child welfare and probation services, for leading the process, for providing policy direction, but also even for making sure that NGO partners, that civil society organizations are well aligned to a very clear case management system that is able to support children and communities, and that is linked to the district level systems that we are working with. We thank our funders, USAID and UNICEF, for the support that they have given us over the years, and the tripartite arrangements that we have with them, the ministry, and so forth, in making sure that we have a stronger workforce in the country. We are an NGO. We are not in every part of the country. The government is in every part of the country, so we strongly believe in workforce strengthening for the government and for district social workers. So at that point, I would like to say thank you very much for giving us the opportunity to share our experiences on what we have been doing in Zimbabwe. And at this point, I will invite questions. Thank you.
Okay, thanks very much. Appreciate this presentation and the work that you've been doing to and your colleagues and so on to strengthen the workforce and services at the district level. I want to remind you, if you have any questions, to write them into the chat window. We'll have about 5 minutes or 10 minutes for some questions and answers for patients, and maybe one question for either one of them. Evelyn Tomaszewski, sorry if I butchered your last name, Evelyn, asked and just said, thank you, patients, very comprehensive design. I am curious about the lateral skills transfer exchange as an excellent way for peer guidance and supervision. It's an excellent opportunity for leadership identification and development. How often might this occur, and how is it supported financially? So it's around the sort of peer guidance and supervision and how that might be supported.
Mm-hmm. Thank you. On lateral skills transfer, like I said, we are looking at two methods of doing it. We either do it through the exchange visits, or we are doing it through those who are better qualified and are giving the support. We've done this. We have case management officers who are on contract that are placed at district level. They have more experience, they are better qualified than the current social workers, than some of the social workers in those districts. So they are working with these officers on a day-to-day basis as we roll out the program. Then we also have, for those districts that need extra support, then that is on a need basis, where the district says, we need support in this specific area, and then a person who is where we have best practice in one district, you then send that person to support that particular district. We started this a couple of years ago. I think 2 years ago, on a low, somehow a low level, trying to see how best it was going to work. But we've noted the benefits of that, and as we move forward with the scale up of our case management program, we will be intensifying this level of support at district level.
Thank you. Megan Murphy had a question about learning more about the case management approach that you used, either whether you can share where we can learn more about the system, or if you can say a few words about the system and how it works, and what you see as the type of tools that make it work, or maybe essential elements of the case management system. So either since we're a bit short on time, either where they can learn more about it, or if you can say a few words about the case management system essentials.
Yes. Yeah. Okay. We will be happy once we get a sign-off on our official tools, the framework and so forth from our government. We'll be able to share that with Megan. But just overall, the way the case management system is designed is that we are looking mainly at two pillars of support. We have the community level structures that are there right now, which support vulnerable children in the form of our child protection committees at village level and at what we call our ward levels before we get to the district. So we have community structures, child protection committees, and in those child protection committees, we have representatives of the community. We have selected volunteers out of that child protection committee, which we call community case workers. Now, these community case workers are the ones who are working as an extension now of the Department of Social Services in identifying vulnerable children and children who need care and support and protection. And those community case care workers are then linked to the formal district level structures of the Department of Social Services, where they are now channeling all the cases that are being identified at the village level. So what is exciting about the system we have is it was difficult for the department and even very expensive for the department to be able to go around in all the villages that we are supporting in reaching out and providing support to children who need services. So we then worked with them to identify a cadre or a cadre at that level who becomes an extension worker, even though they call a volunteer for the department. We have one case care worker for each village. Each village is about 100 households. So that case care worker is familiar with that village and therefore knows which child is sick here, which child needs what support, and so on and so forth. And for the cases that they are able to deal with, particularly welfare cases, so the child might need education support, might be out of school, need education support, might need birth registration, might need might need, to get onto treatment and so forth. Those case care workers are able to work within the case management system, working within the referral protocols to know where to go, which service provider that they can reach to get services for children. For the cases that are complex, which require probation work and support from social workers, they refer those cases to the formal structures of the department at the district level. And it is those social workers at the district level who are able to now take up those cases and support, referral and make sure that those children are able to receive support. So if it is a child abuse case, they are the ones, liaising, working with the police, etc., to make sure that those kids get the services. So that's how the system is structured. It is then supervised and supported by the provincial level structures of the department to make sure that the implementation, the performance, the closure of cases and so forth at the district level is well supported and is effective. And at that district level, what we have done is to place a contract worker who is called a case management officer, who is a qualified social worker, who is working with the people at that level, at the district level, to support the system. So in a nutshell, that's what the system looks like. We have other interested stakeholders as well who are supporting the system in ensuring that we are ensuring quality standards of care and support for children. Like we have the Council for Social Workers who enforce standards of care and quality for child care in the country. They are also involved as enforcers of quality standards. We also have the allied medical health practitioners. We also have lawyers making sure that the standards of care are also upheld where legal issues are concerned and so forth. So it is, in a nutshell, I can say what we were trying to do was to bring the linkages between the community level structures and the district level structures so that they would speak to each other and ensure a continuum of care for kids at the family level.
Okay, thanks very much. We're kind of running into the time limit. There are some other comments in the box that you might want to take a look at, both everybody, and Grace and Patience. I just had one final question for either of you, and it relates to parasocial workers. You both, they're both at kind of part of this district level strengthening work in Uganda and in Zimbabwe. And there's lots of interest in activity around parasocial workers in many countries. And so I think it would be useful maybe if you could look at one thing that you think is a better practice to make the parasocial work role effective. We know you could talk about a lot of things, but if you were to look at one or two things, what might they be? And this is either for Grace or for Patience.
Parasocial workers effective. Did you say to make the work of parasocials effective, what the one thing would be?
Yeah, yes.
For me, I think it's training. If a lot of investment can be put in the training of parasocial workers to understand parasocial work, because that alleviates the burden that already resource-constrained social service district structures have. So if for us, what we have noted, if they are trained in just understanding child protection, child rights issues, effecting referrals, paralegal training, basic support for kids who are sick and need adherence support and so on, and clearly being understanding their role in terms of training, that they are well linked into a government social system, then I think that, we'll get, the best for our buck, as it were. I think training for me is the key one.
Thanks a lot. Training is the key. Grace, do you have any observations on this one?
What was the question again?
If you were looking at parasocial workers that you discussed in the Uganda work, what I was trying to do is focus in on a key element that makes that role effective.
Okay, one is the fact that these community groups already exist. In Uganda, we are focusing on the community informal structures that already exist. We are not creating new structures, we are strengthening the existing structures. And these groups, these mechanisms already have their vision, and as a faith-based organization, or as a clan network, or as a local council court, or a community-based organization. So I think building on what is already existing is very important for sustainability. The other one, of course, is skilling. Oftentimes the communities are happy and are lacking the necessary skills to do their work with children. So we've learned that when we take them through a curriculum-based training, and it motivates them and it equips them, and they are able to perform better. The other one is the supervision and mentoring, the continued supervision and mentoring from the government structure. In Uganda, the training of parasocial workers is delivered by the district probation officer, who is seen as the most professional, most qualified person in the district. And so that creates the relationship, and they are able to continue to support them, to coordinate them, and to provide the support coaching that they require. So that link, continued link and mentorship, is one important aspect of making these structures effective. And of course, where they have referral, where the referral systems are working and they are able to refer more complicated cases that they cannot handle, is very important. So the continued relationship and coordination is very important to sustain this mechanism.
Okay, so some common elements around skills and training, and then you were emphasizing the need for supportive supervision and also kind of community support for them. Excellent. Again, we have a number of questions that have come in around utilizing the volunteer base, and often has issues with sustainability in the long term, and some questions about that. A couple of comments around the system itself, and what kind of collaboration is there between parasocial workers and community health workers. So very good questions. And part of the purpose of the webinar is to create knowledge sharing and also create connections that can be sustained after this is over. So we don't quite have the time to address these questions during this webinar, but we'd encourage you to email each other and be in contact. And so we're going to wrap this up now. I'm going to turn it back to Amy, and she's going to say a few words about to wrap up, and also to say a little bit about how you might stay in contact to continue work on this.
Thank you, Jim. I didn't realize my microphone was on mute. But thank you so much to Stephanie and to Grace and Patience and Jim and to all of you for this great discussion today. We've covered so much, and so just to wrap up very quickly, I think some of the main points that we heard from today is that we know that a lot of this work in supporting children and families happens at the community level. But in order for those services to get the support they need, we need strong systems of support around them. So we've heard from Grace about the programs in Uganda that have helped to create linkages between parasocial workers and CSOs at the village level, to the community development officers at the sub-county level, and then the probation and social welfare officers at the district level, and how all of these people and organizations have been brought together through the coordination mechanisms at the sub-county and district levels. And then in Zimbabwe, we've heard about the child protection committees and the parasocial workers and probation officers. And from both speakers, the breadth of the workforce strengthening support that has made possible all of the impacts that they've discussed, whether that's training or supportive supervision or monitoring and evaluation systems, or the referral systems and case management that we've heard about. They've covered so much, and there's such a wealth of information. As Jim said, the presenters, I'm sure, are willing to have you contact them and be in touch with any additional questions. We have many questions that have not yet been addressed due to the timing of the webinar, but we encourage you all to continue to connect. Also, at this point, if there are any other events or opportunities that you want to announce, please feel free to type the information into the chat window. If you are not yet a member of the Alliance but would like to join and receive notices about future webinars, you can go to the website there, socialserviceworkforce.org, to register as a member. It is free and just requires a short registration form. And then also, I just wanted to note that a summary of this webinar as well as a recording will be posted to the website, and you can also find on the website information about our past 15 webinars. We also have the webinar recordings now posted on our new YouTube channel, which you can find on a link to from the website. I noticed that Evelyn has announced one event that will be held in Kampala in August, and the web link is there in case anyone is interested. Please feel free to keep typing, and in the meantime, I will just say thank you again to everyone for joining us. A big thanks again to our presenters for sharing such a great amount of information, and have a great day.